This is one of the areas in pediatrics within Northwest Florida that, if anything, over the last 30 years, I reluctantly have to say that we've perhaps lost some ground. We had years ago, back in the early days with the DEI clinic and things, Dr. Debbie Goldberg, who has offered to be one of our reviewers, was very active with that. Dr. Melissa Picardi was a fellowship-trained behavior and developmental pediatrician. She subsequently retired. We went a number of years in the community and then had Dr. Kay Lewis, who was here for a number of years at Children's Medical Services, providing a clinic for these children. And then subsequent to her, Dr. Gina Gargas, who has also regrettably retired. We just had some conversations with Sacred Heart recently. They are very actively recruiting. Nearly, they thought, had another behavior and developmental pediatrician set. These are entities who are few and far between by specialty and by training, but they are continuing their efforts to actively recruit in this area. The pediatricians in this area, this program would serve to complement, augment, work collaboratively with them as they work to identify, as Ms. Bickerstaff has said, more of these children. It was not uncommon when I was beginning my training back in the late 70s that these children would wait until they became kindergarten age and got into the public school system and then were identified parents knowing all along, or certainly for some time having suspicions that their children, and fortunately individuals like Ms. Pearl Nelson, who said we can do better than this. And that's what this is about, is doing better with the services that we already have here, working to identify through data collection and other things that will be part of this program to look at where we can do better, where we can put resources, try to augment the services and the providers that are present in the community so that more of these children can not only be identified, but then have some interventions brought into place so that by the time they enter the public school system, they are much more on track and all with their peers. I am going to make this extraordinarily personal. My niece, Cameron Northrup, was one of the recipients of some of the services available through the Art Gateway and the extraordinary individuals there, and the difference it has made in her life in 2 days. She will have her 37th birthday, by the way. She is licensed formally through the state of Florida as an esthetician, having been the first graduate in the state of Florida with special needs to accomplish that on her first pass, I may say. And all of that reflects back to the fact that in her early childhood, she received these diagnostic evaluations. She then got plugged into the services. And one of the other huge things that this works to do is works to empower the parents that long after they have outgrown this 0 to 3, 0 to 8-year-old range, those needs continue. These parents are far more adept and skillful in interfacing with the system of care that Tammy has talked about developing with the public school system, with the providers and others, to see that their children continue to get these services that they need and they benefit from, and that this is a huge step in that direction. And I am just obviously all in favor of it and think it would hold promises to children throughout our community, throughout the county. From Century, I was up in Century just Friday talking with Dr. Miriam Stewart, pediatric provider up there. She is just ecstatic about this and talks about the need, as Ms. Bickerstaff has alluded to, for the various therapies. Even once these children are identified, that these therapies would be in place and these services would be in place. And this is the type of thing, as Tammy has said, that the vast majority of the funding that we've allocated towards this concept would be going directly to those service providers and make those services available and more available throughout the entire county. So with that, I'll hush and open to any questions or other comments.
I have a couple questions. Thank you so much, Dr. Northrup. I know y'all have worked hard on this. My question is, what about the kids that are already on the waiting list? How does this, are we helping provide for more providers? There's a ton of kids I know on a waiting list for Art Gateway, for Paul Nelson, for all the therapies. And so we're going to find new kids who, I talked to you on the phone about 2 kids who needed services last week, and so how do we get them moved up to the list? Are we going to move them up? Are we going to just add new providers? How does this help everybody in the system?
Well, and I will certainly be interested in hearing comments from Ms. Bickerstaff as well. But yes, the intention will be that certainly over time, that there will be funding that will go towards direct services, will go towards the providers of those services. And then, as I say, part of it will be looking at those people on the waiting list. What is the cause of that? One of the things, for example, Dr. Stewart talked about, she knows of several children up in the Century area that she said if we could just get providers into the cantonment area, that would make a huge difference, that trying to get from Century to Cantonment is tremendously not easy, but easier and more able to be accomplished than it is trying to get them down here to town and things. So that we recognize that we do not simply want to identify more children and add to that backlog, that part of it will be working with physician champions that are identified through here. We've already got a couple of those identified, working with other therapists. We've been in conversations, as I say, with Sacred Heart throughout their system of some of their urgent care centers and other outreach centers of ways to try to get those therapists and those services closer to the kids that need them. And that's something that they have committed to working on with us.
But I guess but our money is not going to provide for another doctor or 2, or is it?
At this point, it would not be at the physician level.
Okay.
It would be at the provider level of the therapists and these other providers that we've got the identification. The pediatricians have identified the needs. The therapists.
Like physical therapists and speech therapists, occupational
Speech,
therapists.
occupational,
Gotcha. So our
etc.
money will help with that.
Yeah,
Yes,
that's the 1.4 million on
correct.
the slide.
Okay, I was reading and I was looking for, I guess that's core component number 5 is what that goes to.
Yes.
And the rest, 1 through 4, is the 250,000, the telephone number, the marketing, the put stuff on social media, that's the core component 1 through 4.
And helping with some of that actual care coordination
Okay.
and facilitation. That's another thing I was going to take on a little bit of a connected, intertwined entity is the directory that we have worked on developing. I will tell you that in my time with Children's Medical Services, and I was responsible for all 10 counties in the Panhandle from the Apalachicola River over, that one of the most significant things that we got the most consistent positive feedback from parents, from caregivers, non-parental, as you are very familiar with the providers themselves throughout that area, was a revised and updated directory of services available throughout the region. And some of those services were outside the region. They had to do over with Gainesville or some of the other areas that they went to. But that those families quickly became very proficient at utilizing that directory, asking for the newest copy of that directory, using it to access services. And that was one of the things, as I said, that went along with this education, where they became very, very strong advocates of getting on the phone with their care coordinators and saying, my child needs to go see this therapist, and I know they're available in Defuniak Springs, or they're available over in Baker or wherever it might be. And they just, you talk about taking their directory from them or something, or noticing when they'd come in, it was worn and pages falling out to give them a new one. And they'd say, well, I'll take your new one, but you're not having my old one, because they had so many notes written in it and things. And it was extraordinarily helpful to the care of those children and the empowerment of those parents. And Ms. Bickerstaff, other comments that you may add?
some of the conversation that I've had with our partners in the community, not with all the early childhood care providers, is that we recognize this critical shortage of providers. Actually, at Pearl Nelson, we've had to stop accepting referrals from physicians recently and put a pause on that, which breaks my heart because that is not early intervention. And so a component of this would be being able to fund some outreach to build that capacity to universities that are, within our traveling distance, and to other providers in the community who have already been providing throughout the state of Florida that we might be able to recruit to our area.
One of the things we've done in the